Now we will learn about breastfeeding issues. Some mothers may have problems, especially if the deep attachment or deep latch is not attained. So the baby is not able to deeply latch or grasp at the breast. The mothers may have problems like sore nipple, where the baby just sucks at the nipple and the nipple can get sore. And on day two, when the milk production increases, the baby may not be able to evacuate the entire milk, and the milk gets accumulated in the breast, causing breast engorgement. In some mothers, there may be infection like mastitis, and rarely mothers can have abscess in breast or breast abscess. So we will see how we will deal with all these problems. Firstly, is sore nipple. As I've already told you, sore nipple is because of incorrect breastfeeding technique and the poor position or poor latching or attachment. The baby sucks only at the nipple, does not get enough milk, sucks more vigorously, resulting in the sore or cracking of nipple. Some mothers may also cause cracked nipple by unknowingly frequently washing the areola with soap and water, pulling the baby off the breast while still sucking, or the mother may have other problems like fungal infection of the nipple, which happens usually after the first week. So the fungus, if there is fungus is there, fungal infection is there, the mothers will have itching or redness or scaling at the nipple, and they may need to apply antifungal cream. Usually, the fungal infection happens because of more excessive covering of the nipple areola, which is already wet, and this provides ideal environment for the fungus to grow. Coming to the treatment is ensuring correct position and good attachment of the baby. You can use good positions like cross cradle or football position and attain good attachment so that the areola and the nipple goes deep inside the baby's mouth underneath the palate and it is not injured while breastfeeding. At the same time, the baby can be breastfed. However, if the mother is not able to breastfeed the baby because of severe pain, she can always express her milk every time she feeds after every time she feeds the baby and give the baby the express milk through sterilized spoon or what we call governor. She can apply hind milk onto the areola and the nipple. Hind milk is very good, producing healing effect on the nipple because hind milk contains epidermal growth factors and stem cells, which helps in the healing of the nipple. It also contains immunoglobulin and immune cells like macrophage, which helps in fighting the infection. And also, the mother needs to keep her nipple and areola dry, avoid too much covering, exposing the nipple to air in between feeds, and do not wash the nipple each time before and after feed. Keep the nipple dry. Coming to the engorgement. Engorgement can happen as a primary event after 24 to or 72 hours, that is after the first 1 to 3 days of feeding. It happens because of increase in the milk production and that reduced evacuation of the milk by the baby usually because of poor attachment. And it can also happen as a secondary event where the milk supply suddenly increases and it exceeds the milk removed by the baby, or if the mother is not frequently feeding the baby, there is delay in feeding the baby, or the baby is not well positioned at the breast. So this is an engorged breast with full of milk inside, and the milk has not been evacuated by the baby. And the engorgement itself will reduce the milk production. Therefore, in such mothers, after 1 to 2 days, they may experience a reduced milk supply. These mothers may feel ill, may have fever. Fever may last for around 16 hours. The breast may be swollen, firm, warm, and tender. So, how to prevent and treat breast engorgement? Prevention is by correct attachment of the breast to the baby to the breast, early and frequent feeding, and express the milk gently using hand every 2 to 3 hourly, and feed the baby a sterilized spoon or gokarna, or discard the milk if the baby is not accepting excessive milk. However, at this time, the mother may be uncomfortable in using breast pumps because the breast pump may be difficult to use in an engorged breast because the skin is already too tight, and the pressure of the breast pump can cause damage to the skin of the breast. So, best thing is to express the milk using our own hand. In the next presentation, I will be teaching how to express the breast milk using hand, and also how to express the milk using pump. Now, fourthly, she can apply cool packs and oral pain medicine to reduce pain, such as paracetamol or acetaminophen. She can also use, if cold packs are not available, she can also use warm water packs. But cold packs are better than warm packs, and warm packs should not be placed more than 15 minutes. And she should express gently the milk every 2 to 3 hourly. Yes, especially during night, she should express at least 4 to 5 times because the milk is being continuously produced in the breast. She can support her breast using a loose brassiere. And all these measures will facilitate the softening of the breast and also to correctly latch the baby. Now, the next problem is mastitis, which is the infection of the breast tissue, mammary parenchyma. Some risk factors may cause infection, like a block in the mammary or the breast duct, or infrequent or incorrect feeding, or a rapid weaning can also cause mastitis. The bacteria enters the breast through the nipple, through fissures or small abrasions. Infection is almost invariably unilateral. Mother may have fever and fast heartbeat, chills or rigor or breast pain may be there. Breast becomes hard, red, and tender. And in 10% of mothers with mastitis, they may develop abscess, which is the collection of pus in the breast. How to treat mastitis? Again, breastfeeding should be continued. Ice pack, pain medicine, and breast support can be done. Express the milk every 2 to 3 hours. Now, if the breastfeeding should be continued in the opposite breast, in the breast which is affected by infection, express the milk and discard. Some of the common organisms which can cause a mastitis or the breast infection is Staphylococcus aureus, Coagulous negative staphylococci, or Streptococcus viridans. We can use antibiotics as prescribed by the doctor, amoxicillin, clavulanate, or cephalexin, or digloxycillin. Express milk from the affected breast can be sent for culture and sensitivity before starting the antibiotic treatment. Breast abscess. Rarely a mother with a breast infection can have accumulation of pus in the breast tissue, which is called a breast abscess. It is a complication of poor attachment, which leads to crack in the nipple, engorged breast, and finally breast infection. And these mothers will present with high-grade fever, pain, swelling, redness, tenderness, and induration or thickening or tightness of the breast. Breast abscess should be suspected when the fever persists more than 2 to 3 days of breast infection treatment, or when the mass is palpable, or in ultrasound it shows presence of abscess are shown in this slide. This is a picture of breast abscess where abscess formation is seen in the lactating breast. and you can see a abscess which is palpable, and the skin over the abscess may be very thinned out. Sometimes the milk comes from the nipple, continuously comes from the nipple. So what is the treatment in this case? Again, continue breastfeeding from the other breast. Don't feed from the same breast. However, from the affected breast, as in breast infection, you can regularly express the milk and discard. You can use ice pack and pain medicine and breast support, antibiotics, and drain the breast abscess. So if there is pus, you have to drain. For draining, you may need to do incision. It is done by a surgeon. And ultrasound guided needle aspiration under local anesthesia is preferred because it is less painful and has better recovery. So ultrasound guided needle aspiration can be done instead of doing an incision and drainage. Thank you for your patient listening.